From now on the daily tile that comes out from Health at 11 a.m, we'll make sure we have a running tally of the percentage of first and second doses, so everybody can keep a tally of where New South Wales is exactly up to. So today we have 76.4% of our adult population who've had a first dose and 43.6% who are fully vaccinated. Now, it's when that number hits 70% double dose that we know the Monday after that we'll be able to have those freedoms that we outlined in the roadmap yesterday. So if anyone is interested in following the daily tally, that's now publicly available. So it'll have the number of jabs, but also the percentage as we inch closer to that 70% double dose vaccination. But as the health experts, Dr. Chan and the government has been saying, we're really keen to see that first dose rate hit 80 and above and get as close to 90 as possible, so that when we open up at 70%, we have a large proportion of the adult population who are at least one dose vaxxed, and obviously we know we'll get closer to that 80% sooner as well. To 8 p.m. last night, we had 1,542 cases of community transmission, and as the modelling we released indicated, we are expecting the peak number of cases to happen in the next week or so, and so far this trajectory is what has been predicted. And regrettably, we did have 9 deaths to 8 p.m. yesterday, and we extend our deepest condolences to the loved ones of those families, and Dr. Gao will go through the details. In addition, as you know, from Monday, because we got to that 6 million jabs by the end of August, we promised there'd be additional freedoms. Just a reminder that they kick in on Monday, and there's a couple of extra tweaks we've made to make it a bit easier for people. So if you live within an LGA of concern, obviously you can exercise unlimited. However, if you're vaccinated, your household can go out for a picnic or recreation for 2 hours every day, in addition to the exercise. So you can obviously exercise, but if you just want to sit down and have a picnic with your household, so long as the adults in that household are vaccinated, you're able to do so for a couple of hours every day as well. But of course, that has to be within the 5 kilometre radius requirement. So everything else stays the same, curfew in the 5 kilometre radius, but if your household has vaccinated adults, you're able to, and for this definition we're just saying over 18, because not everybody over 16 has been offered the vax, but if your household that lives together every day and functions together every day, you're able to enjoy some recreation in addition to the exercise provision. And for those areas outside those local government areas of concern, as you know, from Monday you'll be able to have 5 vaccinated adults who live within the LGA or within 5 kilometres of their home come together, so long as all the adults are vaccinated. We're not including 12-year-olds in that definition, so a 12-year-old or under in that definition. That means you can have 5 adults, which was the previous rule, but now you can have kids under 12 as well. You might have 2 kids each for each adult, for example, so long as you stick to the rules otherwise. Within the LGA and within 5 kilometres, you're able to have children under 12 not included in that 5 number. So today also we're very pleased to have Commissioner Dominic Morgan here, who heads the New South Wales Ambulance Service. As you know from the advice and the modelling we provided publicly, we're expecting peak hospitalisation and intensive care needs to peak in October. And Commissioner Morgan today will outline how integrated our ambulance men and women are in that program. It's really important for us to have all of our primary carers, all of our health staff who are involved in providing that critical care, whether it's at the emergency level at ambulance or in our hospital system, working together as one team. And Commissioner Morgan will outline some of the things that the ambulance service has undertaken in preparation for that surge. Also, from next week, I don't know how this will be received, but the 11 a.m. information will be done by health staff through video link, as occurred before, and Minister Hazzard or I will intermittently hold press conferences as required. So the weekend, Sunday will be the last day we officially do the press conferences in this way, but from Monday at 11 a.m, Health will provide their daily updates with all the figures, and myself or Minister Hazzard or any other relevant minister will present to the community on a needs basis. But I just want to give this strongest message, if I can, and that is we can't afford to have people let down their guard. All the work we've done in planning, all the work we've done as to what we'll be able to do at 70%, and then obviously once we present the 80% double dose, is based on the fact that these restrictions remain in place until otherwise advised. Because if anything happens contrary to the modelling or what we expect, we don't want to have to revisit anything. We want to make sure that all of us enjoy those great things that we're looking forward to when we hit 70% double dose vaccination. And we are, as the model predicted, at a critical stage, because we envisage that once we get through the middle of September, all those people that have been vaccinated are going to kick in the numbers and show that the spread's reducing. One local government area which unfortunately has seen a spike in the last few days is Canterbury-Bankstown, and we just want everybody in that area to be extra cautious. There was some stabilisation there, but the cases have gone up a bit. And Dr Gale wanted us to also call out parts of the inner city. Redfern and Glebe and the like are showing some indications of increasing cases. So please be on alert. Do not let down your guard. We are doing incredibly well as far as vaccinations are concerned, but please follow the health orders. And if you're home and are breathless, you should be ringing one of Commissioner Morgan's people at the New South Wales Ambulance, 000, to make sure you get to hospital, because deterioration can occur very quickly. And make sure that if you experience breathlessness as part of your symptoms of COVID, that you contact emergency services.